Hi everyone. I wanted to show you guys this little model that I have here in the office, and I like showing this model to my patients because it's a great effective educational tool for disc injuries or back injuries in general. Um, my next blog is going to be about disc injuries, and so I'll give you the rundown on this video in case you're not big fans of my blogs. Anyways, when it comes to discs, it's pretty straightforward, but let's talk about a few terms here. You might have heard of a term called degenerative disc disease. It's just a fancy word, fancy term for a wearing out of the disc. And you probably know we are sitting more often than ever before, whether it be through lifestyle or just our jobs themselves require us to sit for longer periods of time. So, unfortunately, our discs are affected by that. And so, we want to conserve our discs as much as possible so we can keep moving because that's part of the function of a disc is to cushion and to provide movement to our spine, right? So, it's very important that we take care of our discs. Now, when it comes to certain disc conditions that I see, typically I see a patient that has had or is having a disc bulge or disc herniation. So the difference is if we look at the structure itself, here's the bone. These are the nerves back here, and this, as you can imagine, as you can guess, this is the disc. Over time, we will start to squish on that disc, and it becomes what you might see on an MRI report be classified as a disc bulge. And that's basically what that's happening here. It's just a pushing, a squishing of the disc itself to the point where if it gets really bad, then we might experience what's called a disc herniation. And that's where the jelly part of the disc becomes so squished that it starts to push onto the nerve that is near that disc. And as you can imagine, somebody that comes in with a disc herniation, that looks very painful, and it is very painful if you've experienced a disc herniation. So it's very important to avoid these things as much as you can. Now, I mentioned lifestyle changes, but sometimes, accidents happen. So people fall off their roof, a sports injury, that's where these things can occur in your spine, right? So it's important to get that treated right away so you're out of pain and you avoid further complications. Now, chiropractic, what we do is we adjust the spine, right? So we adjust those misalignments that can occur from a disc herniation, right? Something like this, where you have the disc herniation here, but obviously there's a misalignment in the spine. What we do is adjust that. So we reduce that pressure on that nerve and we realign the spine. That's basically it. Um, the other options that you can that you have is physical therapy. Now, it's very important to do physical therapy as well. If you've been to a physical therapist, they're pretty boring exercises from what you guys have told me, but they are effective. It's meant to strengthen the muscles that may have been injured through a disc injury, right? Because there's muscles here and there's muscles here, there's tendons, ligaments, and so we need to strengthen that entire area, that entire joint. So physical therapy is important. Massage therapy is important to address the muscle problem. Acupuncture also can be very important when it comes to disc injuries too. So all those things are treatment options when you have a disc bulge or disc herniation. But there might come a time where this is so damaged or so worn out where none of those options are a good option. So then you'd start to look more on the medical side where you might get an injection, or you might, God forbid, you might need to have surgery. But you want to try and avoid that as much as possible, right? So that's where I encourage you guys to address these problems right away instead of having this become a bigger problem later on, right? So those are the treatment plans available. If you want to be really proactive about it, you can obviously proper posture, a good diet, because a good diet will help us keep the pressure off the spine by keeping the weight off. And also, proper diet will nourish the disc itself through collagen-rich foods. If you want to go a step further, you can take supplements. That is a good option, provided you have a decent diet And I take supplements a lot because it's just more practical, in my opinion. So feel free to look at a supplement, a high quality supplement. I don't know what this was, but a high quality supplement. You want to look for labels on your supplement bottles to make sure you get the greatest bang for your buck, and that should help with your spine, with your disc conditions as well. All right, so that's the other. That's probably the more proactive part of it. Obviously, exercise, walking, getting up from your chair, moving around. Mobility is so important when it comes to your spine and your disc. So make sure you try and get those steps in as much as you can. So that's basically the gist of this model. I like showing off this model because it looks so cool. But trust me, if you've ever had a disc herniation, it is not cool. It is very painful. It is very discomforting, and you want to avoid this as much as you can. Okay. So I hope this video was helpful for you guys. I hope this was effective. And please take care of your spine, take care of your discs, and I'll see you on the next video. Bye for now.